the local representative.
Governor Cuomo, can you tell us, it's very unlike you to stay away from a situation like this for so long. Just yesterday you were out there in the Hudson River, hours after this barge collapse, something you're known for doing, rushing to the scene, hooking up cars yourself on the highway during snowstorms, but we're at more than 100 days since this really started to be known. Why have you stayed away for so long personally?
Yeah, well, what you're leaving out is the facts of the circumstance, right? We're dealing with issues all across the state. You go personally where you need it personally to do something. In a snowstorm, that's a different situation. When you have a tugboat accident yesterday where you're still not sure where the bodies are and if people are alive or dead, and you have state police divers that are going to put their lives in jeopardy to dive to try to save someone's life, that is a different situation. On this situation, I was involved as soon as I heard about it. We had meetings, discussions. It's about the installation of filtration equipment. I saw the filter today. It's an attractive filter. It's a big filter. It looks good in gray. I don't know if they come in other colors. I don't know if they have a designer model. But my seeing the filter and touching the filter was not all that relevant, I think. But it was a nice filter. The threshold question was from day one. Okay, we've identified that this chemical needs to be filtered. Can you filter the chemical? Yes or no? How do we do it? Who bears the cost? That was always the question. And that was not an on-the-ground question. That was an engineering question, a science question, an operational question, a financial question, and that's how we dealt with it. But it is a nice looking filter.
Did you stay away at all because of the criticism? The health department has been extensively criticized here. You guys talk about the preparation, but that's not the general public sense.
Every system, first of all, every situation that deals with an emergency, there's always criticism, always criticism. Some snarky reporter always finds something to criticize. I think it's in the job description.
Well, looking for the truth, yes.
Yeah, or just looking to criticize, right, depending on your point of view. So if you were going to stay away from a situation because you were going to be criticized, you would be under your bed as an elected official across the board, all right? So no. Second, I think the state has performed admirably here, as you've heard from everyone. Now, you can have your own opinion, but then say, that's my opinion, right? Local officials say the state did very well, but my personal opinion is they didn't. And then your expertise will be your credential.
But Governor, I think the reason why there's a lot of criticism is because we've asked questions like, for example, when did the state find out PFOA existed here? And we never got a straight answer. So I'm going to ask you again, when did the state find out that PFOA existed?
We can get you the dates. When the state, there was local testing done, the county was notified, the state was notified from the county that PFOA was detected. This next question becomes, and what does that mean, PFOA was detected? What do you do? What's the right level? Is it safe? Is it unsafe? And that's where the state, frankly, steps out and the federal government steps in. We recently did a letter to the EPA, 3 governors. The state is not going to set a level for PFOA. It is not our place. We don't have the capacity. We're going to look to the federal government to say to us, this is the level of PFOA for short-term exposure, long-term exposure. Once they set that level, then it's our responsibility, state, county, local, to make sure we are doing what we need to do to hit that level.
But other states haven't waited for that. I mean, New Jersey is 20 parts per trillion. We know that 40 parts per trillion. Vermont is 20 parts per trillion. I mean, they haven't waited for the EPA to come down.
That's right. Well, we were following the EPA guideline, which was 400 parts per trillion for short-term exposure. There was no EPA guidance for long-term exposure, which then became the question, as I understand it. There was only a short-term exposure number. The early tests that came back, there were 2 water sources that were above the 400. They were taken offline. The question became, what was the right level for long-term exposure? The state has not set that number. We don't anticipate setting that number. We're looking to the EPA, which frankly has more capacity than we do, to set that number. And the reason 3 governors did a letter is our position is we should all have the same level. It makes no sense for Vermont to have one level and New York to have one level and another state to have one level. If it's unsafe, it's unsafe. If it's unsafe in New York, it theoretically is unsafe in Vermont, right? If you can't drink that level in New York, you shouldn't be drinking that level in Vermont. So we think the EPA should set a number, and whatever that number is, we'll follow. But we need the number.
So the water doesn't test, but in terms of, has there been any testing of municipal or private piping? Is there any, residual PFOA in that? And then is there a long-term remediation plan for something like that?
Yeah, well, 2 steps. First, you put in a filtration system, temporary filtration, which we put in. Today we announced that we tested that temporary filtration and it works. You get non-detect from the other side of the filtration system. Technically, you go through a period of flushing the system to get out the old water that had the PFOA in. We have gone through that flushing system. We're completing that flushing system because it's a very elaborate process. Once the flushing is done, you know it will be a non-detect because the source coming in is non-detect. Your second question is, well, what's the long-term plan? You have a temporary filter, what's the long-term plan? The long-term plan, ideally, is a new water source that doesn't have PFOA to begin with. And that's what we're researching, possibly with this well number 3, possibly the Hoosick River, less probable a reservoir that is miles away, but that is the next barrier, the next question, what's the long-term solution? Could be a permanent filtration system, and then the question becomes who pays for the permanent filtration system long-term? And that could be a question of the consent decree and legal liability.
Not to get too far into the weeds, but is this a type of chemical that could be, absorbed into a water pipe that you have to worry about it, long-term like that at all?
No, not for what we know now, right? Now, again, all of this is shifting, and the answer is no today. Would I be shocked if 2 years from now they said PFOA could be absorbed into some plumbing equipment, but not from what we know today.
There's a bill that's been proposed to lengthen the statute of limitations for people in Hoosick Falls and across the state that, have cancer, other type of illnesses, so that they would be able to file a claim, they won't be left behind because of this issue. We're gonna be supporting that.
I'm going to work with the senator on the issue. I understand the application here in Hoosick Falls, and we're going to take a very aggressive stance with the company. As I mentioned before, we want the company to pay a number of associated costs. We want them to pay 6 months of the water bills for people who have gone through this inconvenience. We want them to pay the ongoing maintenance of the individual systems that are established on the well. Long term, we want them to pay not only for the temporary system, also the permanent system and the maintenance on the permanent system. So we'll take a very aggressive position on the company and making sure the people of Hoosick Falls get every penny that they are entitled to get to. The overall question of statute of limitations is a little more complicated because one of the points is you want the claim timely enough that you can defend yourself and still have the information that you need to defend yourself.
Governor, you said this is going to be found in other communities. That seems like kind of a passive response to this. Is there anything more aggressive the state could be doing in terms of testing in other communities?
Well, does the
testing in
New
other
York
parts of the
Times
state?
believe that there'll be no other chemicals that are ever found that are currently unregulated that may be regulated?
But is the response simply to sit and wait for communities around the state to discover this in their water supply?
No, we'd be very aggressive about it, but you can't test for something that has not yet been determined as a substance that should be tested for. Right? My point is, in the future, I would not be surprised, and I would expect to see more of these situations where chemicals, new chemicals become added to the regulated list.
Right, but specific to PFOA, this is
The
something.
PFOA, we understand. I'm saying beyond PFOA.
But is this something that you'll test for in other communities, other
Yes.
parts of the state?
Yes, but you still need, Jesse, the allowable limit and standard that you are going to test to.
But there are, the other states have limits, the feds have a limit, the European nations
No,
have
the
limits.
feds have an
Environmental
advisory.
groups?
That's not a factually accurate statement, what you said. What is the EPA regulatory limit for long-term exposure for PFOA?
It is not set,
Ah.
but the recommended level
Oh,
is
oh,
100,
oh,
so.
it's not set. I thought you just said that EPA had a limit.
But why do other states? They're
it's
going
not
with
set.
the
But-
number 20 in Vermont, just a few
I know
miles
you-
away. Why was your DOH going with the 50,000 parts per trillion? That seems like a tremendous discrepancy, and that is something that the DOH has still yet to answer for. They told people in December it is okay to drink the water here. That is why we keep asking you about
I
this
hear you.
every time you make a public appearance,
Yeah.
and it has not been answered yet.
Here's the answer. The DOH looked to the EPA. The EPA had one number.
400 parts per trillion back from 2009. That's not a shifting number. Other states picked up on it and they put that in their state laws. We did not. That's the criticism.
No, well, that can't be the criticism, because they did test for the 400, and the wells over the 400 they took offline. The question is, that was a short-term exposure. The question is, what is the long-term exposure number? That has not been set. They have done a recent advisory done by the regional director here that sets it at 100. That is not a national standard. That is not an EPA regulation. That is just a regional advisory. Jesse's point is well taken. EPA says 100, Vermont has 20. Which is it? 100 or is it 20 for long-term exposure? And we're saying, in a letter with the Vermont governor, we need clarification on that. And by the way, just pick it. You have the scientists, EPA. We want a national standard because this shouldn't be a question for anyone. And I don't want Vermont to have safer standards than New York. I don't want artificially low standards, Well, why don't you pick the lowest number possible? Because then you could have hundreds of communities installing very expensive filtration systems that don't need it. So it's not just as simple as, well, pick the lowest number that you can, right? Because that's not responsible either. And we're saying to the EPA, we need a common standard and a common number for all states for long-term exposure. That has not been set. Mr. Jesse is right. The regional director in New York, in the midst of this situation, said, I think 100, which then is problematic because other states have different levels. And if 100 is too high, we don't want to use 100. I just want to know what the right number
Is
is.
the state
Governor,
trying to protect St. Gobain or other companies. I mean, these companies signed consent orders saying they would stop using PFOA. Some of them stopped using it back in 2000, 2003, Taconic 2004. Nobody was notified. They knew it was bad. That's why they stopped using it, yet nothing was done as far as the health department or any of that.
I can't speak to that. I wasn't here. But you couldn't be more aggressive with San Gobain than we are being. I went through the number of claims we're going to make to San Gobain. I am sure San Gobain's position is going to be that we are overly aggressive and asking them to pay for things that they shouldn't have to pay for, is my guess. And my guess is this is going to become quite contentious with San Gobain, which up until now has been saying all the right things.
Governor, private wells, people with private wells, if you're installing these, what's the long-term solution for them? Are they gonna be connected to this new, and I know that's a plan, or are they gonna be paying for carbon for the life of the filter?
That's a good question. That is the second threshold. Short answer is, that's what we're working through now. What is the long-term answer? We have temporary filtration, et cetera, it's working well. What is the long-term answer for the village and the town? What is the long-term answer for private homeowners, well users that have filtration systems? I think you can narrow it down to two basic options now. If they have a well system, it will be installed at the expense of San Gobain. That's our position. That'll be part of the consent decree. We want San Gobain to establish a maintenance fund to reimburse that homeowner, well user, for the maintenance of that system for the period of time up until the Department of Health tests the water and says there's no need for the filtration system. So our position is the homeowner shouldn't have to pay for the installation, the homeowner shouldn't have to pay for the maintenance, up until the point that it's no longer necessary and could basically be disconnected. When would that point come? I don't know. It depends if we find an alternative water source or not. But in any event, our position is San Gobain should pay all the costs up until that point.
Governor,
Does that answer your question?
Governor, did you meet with actual residents of the village today?
We met with a number of people. We toured a number of sites. I met with primarily with the elected officials.
Okay, and would you agree that this is a frightening situation for a lot of people out there? In our reporting, we find a lot of people scared. You know, this is a central element of daily life.
If I lived in Hoosick Falls and I heard the news broadcasts, I would be frightened. If I had a family here and my kids were drinking the water, I would be frightened. The hyperbole, the confusion, the shifting facts would frighten me. 400, 100, 20 in Vermont, nobody knows what the right number is. I would find it frightening. That's why we've worked very hard to say we're doing everything we can do. And let's just get to the basic facts. What can you do? A lot of hype, a lot of noise, a lot of tumult. What can you do? Get the water filtered. And get the water filtered to a point where you have no PFOA in my water, right? What does a resident want? If I'm a resident, get the PFOA out of my water. That's what I want. And I want the PFOA out of my water tomorrow. And by the way, I don't want to pay to get the PFOA out of my water. And by the way, I don't want to pay for the water that I've been using and then have to go get bottled water at a store. That's what I want, number one. Number two, I want an alternative or a long-term water source where I know I'm not going to have this problem. Those are the two things I want. And those are the two things that we've been trying to deliver. Today we can say we have accomplished step one. These filtration systems will take the PFOA out of the water. and you will not have to pay for the filtration systems. Period. That leaves us with the second question, what do I do long term? That we're working through now. Maybe well number 3, maybe permanent filtration that you don't have to pay for, but we don't have the specific answer on the long-term permanent alternative. But people should feel good that what they have been asking for has been accomplished.
Has the EPA
The
responded?
PFOA is out of the water. In the meantime, connected to question 2, the alternative water source, we need to get from EPA, and we have not yet heard from EPA, what is the long-term allowable standard for PFOA that is uniform and based on science and is not a guess and is not a reaction to a particular situation, which applies to Vermont and New York and every other state. But today is good news. And also, Hoosick Falls, Hoosick Falls, Hoosick Falls. This is not unique to Hoosick Falls. This is a problem that communities all across the state already face and will continue to face. So it does not have any long-term effect on the quality of life in Hoosick Falls. Thank you very much.